I've got things in different orders, so it's kind of confusing me a little bit. That was on this test. This was on this test. This was that. Let's do it this way. 15 minutes this weekend, and you have specific questions. Do not hesitate to contact me, email or text. I'll be around. I will be working in the afternoons, although the person I'm working with won't mind if I answer emails. So I will try to get back with you as quickly as I can. I guarantee within 24 hours, but I don't guarantee before that. I will check my text when I go to dinner Saturday night and again Sunday night. Okay. If you don't mind me texting you back at 1 or 2 o'clock in the morning, I will answer your questions at that point. So, okay. What age group commonly has recurrent, if I don't like that one, we're not going to do that.
Which one?
Yeah. Okay, let's find the study questions for immunodeficiency diseases. Find that study guide. IgA, Bruton's A gamma globulinemia, IgA deficiency, DeGeorge, SCID, and chronic granulomatous disease. I pretty much am just going to put something on there basically that is exactly the definition that was given on the PowerPoint. Okay?
You said everything but IDA deficiency?
No. Burton's, IgA, DeGeorge's, SCID, and chronic granulomatous. Okay? There's only going to be 1 or 2 questions on that. So just look over it, be able to identify the differences basically. Okay? What 3 tests can I use for screening for immunodeficiencies? And what 3 confirmatory tests that I can use? Pretty much that's going to be basic. I'm looking probably 5 to 10 questions on this one. And see, I'm writing it down, so I'll make sure. Which lymphocyte is commonly associated with immunoproliferative disorders? Well, both of them. I'm not quite sure what that question is. What is the difference? Okay, difference between leukemia and lymphoma. That one you got to know because you had to know it before. I'll make you know it again.
Site of origin.
Oh, I'm sorry. Move on to the immunoproliferative disorders. Sorry, my apologies. Turn the page. Immunoproliferative disorders. What is the difference between leukemia and lymphoma?
Site of origin.
Site of origin, where it's at. Compare and contrast multiple myeloma and Waldenstrom's macroglobulinemia. Basically, what I want you to know here, multiple myeloma tends to be Ig. It can be any of them. Multiple myeloma can be any paraprotein, any of our immunoglobulins. And which is Waldenstrom's? It's IgM, macroglobulinemia. Okay. How am I going to test for these? IFE, immunofixation, electrophoresis. Okay. In protein electrophoresis, which region is elevated?
Gamma.
The gamma globulins, the IGs, the immunoglobulins, the gamma globulins are going to be elevated. Okay, in Waldenstrom's, I'm going to see a peak in the IgM. In multiple myeloma, it could be a peak in any of them. I don't think I've ever seen an IgE multiple myeloma, but it's possible. What is something else I'm going to see? What other test am I going to see positive in multiple myeloma?
Bench-Jones.
Bench-Jones proteins. When? Where? If I gave you an immunofixation result, would you be able to tell me? I'll label what's where. Let's go into autoimmune. I want to do quite a bit on Like I said, the immunoproliferative ones, other than a couple questions on multiple myeloma and Waldenstrom's, I'm not going to go much into them. Do keep in mind that any of our immunoproliferative diseases we talked about in heme, any of our lymphomas, any of our lymphocytic leukemias, these can all lead to secretory problems, but the one that is most associated with disease of the immune system is a T cell or B cell, and especially our B cell, which is our multiple myeloma and our Waldenstrom's. But if you go back and look at your hematology notes, there were, 14 or 15 lymphomas we talked about? So there were quite a few of them that can be cancer of the proliferative, or of the immunology disease. Looks like page 125 is going to give you autoimmunity. What does it mean? What does autoimmune disease mean? What are we talking about when we're talking about autoimmunes?
Self from not self.
Self from not self. Our body is confusing itself somehow, and it is causing us to be sick. So it's attacking itself. Give an example of a systemic autoimmune disease. Lupus and RA both are, but especially lupus. An organ-specific autoimmune disease. Graves. On the PowerPoint, I do believe there was a list of disease states and the organs which they attack. You need to be able to match those up. I can pull that one up. I'll pull it up so you can see what slide I'm talking about.
This slide number 6, the first slide.
Yep. We have Hashimoto's thyroiditis. Which one is that? What does that attack? How about Graves' disease? IDDM, pancreas. Multiple sclerosis,
Nervous.
myasthenia gravis, and good pastures. So you do need to be able to, you need to know those. We're also going to add to it, actually, chapter 14, page 214, slide number 7, all of those. All of these.
Is that from the book?
That's in the book. Page 214.
214.
So Hashimoto's, Graves, pernicious anemia, gastric parietal cells, Addison's, adrenal, type 1 diabetes is the pancreas, myasthenia gravis and multiple sclerosis, autoimmune hemolytic anemia. That one I could have put on there without warning you, and you should have been able to figure that one out. ITP, good pastures, RA, scleroderma, and lupus. And scleroderma is most commonly associated with the skin and the gut. You'll get skin problems and you'll get severe GI disturbance in scleroderma. Okay? You need to be able to match those up. Whether it'll be matching or whether it'll be a half a dozen questions individually, I don't know. Okay. Clinical symptoms of lupus, and what test am I going to use to diagnose most of these autoimmune disease? What's a common screen for them?
Double stranded.
ANA is the common screening test. And then, Chris, what is the diagnostic test for lupus?
Double stranded.
Double-stranded DNA. Okay, so lupus is double-stranded DNA. We're going to talk more about, I'm not going to worry so much about treatments. In general, steroids. is your generalized treatment for these. There are a lot of bioactive ones, and Barb said she has a lot of information on how those newer bioactive drugs are working. So you all dodged a bullet because I didn't know that information yet, so you guys don't have to learn it. So, you need to know RA, what's our screening test? What are we looking for when we're testing for RA? Rheumatoid factor. Is the test always going to be positive? No. That's something that's very important to remember with these autoimmune diseases, that the tests are not always positive. We're also going to, for RA, we're going to be looking for an RF test, and we're also going to be doing a CCP. We've talked about the ANAs. You need to know the patterns. What are the 5 patterns? That's question number 9. What are the 5 patterns? Homogeneous rim, centromere, speckled, and nucleolar. You need to be able to match up which, if you remember right, I said, let's see if I can find it. Hang on, where is it? Slide. This slide right here. Slide number 20. Okay? You need to be able to match up these these patterns with their antibody and what disease state it goes with. Okay? Keep in mind, this speckle goes with more than just lupus. This slide's a little misleading. Speckled is positive in many of these diseases.
Are you going to differentiate between speckled and primary speckled?
No.
Okay.
The big one, centromere, is going to be scleroderma or systemic sclerosis. They're both very similar. This will be scleroderma. Nucleolar is going to be systemic sclerosis. RIM is going to be drug-induced lupus, and homogeneous is going to be double-stranded DNA.
Never mind.
RIM is going to be antihistone, which is associated with drug-induced lupus. I will limit make sure for each of these disease states, each of the disease states in the autoimmunity, the ones I told you have to be able to match up, know basically what you're going to be seeing. The thyroid ones, they're hyper and hypothyroid.
Talk about 13, A through J or whatever.
Yes. And again, I'm not going to ask super in-depth questions on those. It's going to be fairly general, but you do need to know all of those. What parasite is used in the double-stranded test? Crithidia. And I won't give you more than one Crithidia. They'll just, what's that? Crithidea, I think. Hypersensitivity, page 129. And we decided HIV is going on the next one, right?
Yep.
Define hypersensitivity. What?
Extreme reaction.
Overreaction. Okay, what type, so we have 4 types of hyperimmunity, very difficultly named 1, 2, 3, 4. Which one is a delayed hypersensitivity reaction? 4. Okay. So answer question 2, 3. What are examples of type 1 hypersensitivity? What antibody is associated with type 1? IgE. Okay. Really, basically, type 1, 2, 3, and 4 know the antibody, know the test, and know some examples. For type 4, instead of knowing the antibody, you need to know the cell. And the cell there is our T cells. Okay. And what well, no, I'll put that on there. Make it focus. So there's actually, it doesn't sound like a lot, but there's a lot of information for this next test. Okay. If you have specific questions while you are studying, please do not hesitate to ask. Okay. Like I said, email me or text me. If you want a quicker answer, text me. Email I probably won't answer till Saturday morning, Sunday morning.